Welcome to another deep dive, folks. Ready to explore some fascinating medical conditions with me?
Absolutely. Let's unravel these medical mysteries together.
Awesome. The notes you provided cover a lot of ground, from neurological conditions like meningitis to heart conditions like endocarditis. Where should we begin?
Well, why don't we start with the nervous system?
Okay, sounds good.
Yeah.
Let's start with something that really caught my eye, pyogenic meningitis.
Yes. A serious infection of the membranes surrounding the brain and spinal cord.
Right, and what's really alarming is the presence of pus cells in the cerebrospinal fluid. That's a pretty bad sign, right?
It certainly is. It indicates a significant inflammatory response. In India, we often see Haemophilus influenza type B and Streptococcus pneumonia as the main culprits in children.
And what I found surprising is the connection between seemingly unrelated conditions like ear infections and pneumonia with specific types of meningitis.
The key is understanding how infections spread. Bacteria from an ear infection, for example, can travel to the meninges, triggering meningitis.
So our bodies are really interconnected in ways we don't always realize.
Exactly.
So walk us through what happens during a meningitis infection.
Well, the body's immune system tries to fight off the infection, which triggers inflammation in the meninges. This leads to the formation of pus.
And that pus can cause problems, right?
Yes, it can obstruct the flow of cerebrospinal fluid, potentially causing hydrocephalus, a buildup of fluid in the brain. And to make matters worse, it can also damage the cranial nerves.
The cranial nerves.
Yes, the ones responsible for vital functions like eye movement, facial sensation, and hearing.
Oh, wow. The symptoms described in your notes, headaches, drowsiness, fever, neck stiffness, and even coma paint, a pretty grim picture.
They are serious symptoms, and early recognition is crucial. Prompt medical attention can make a big difference.
You've highlighted the importance of glucocorticoids in treatment, specifically dexamethasone. Why are they so vital?
Glucocorticoids are powerful anti-inflammatory agents. They help reduce inflammation and potentially minimize complications like hearing loss and other neurological consequences.
So they protect the brain and spinal cord from further damage.
Precisely.
One fact that really stood out to me was the statistic that mortality doubles if meningococcal disease presents with sepsis rather than meningitis.
Sepsis is the body's extreme response to an infection. When meningococcal disease leads to sepsis, it becomes much more life-threatening.
And for those in close contact with meningococcal patients, your notes mentioned the importance of rifampicin.
Rifampicin is an antibiotic that helps eliminate the bacteria from close contacts, preventing the spread of the disease.
Meningitis is definitely something to take seriously. Let's switch gears now to Parkinson's disease. It's fascinating how diverse movement disorders can be, from those involving excessive movement to those where movement is limited.
It all comes down to the complexity of the brain's motor control system, particularly the basal ganglia.
The basal ganglia.
Yes, a group of structures deep within the brain that play a crucial role in coordinating movement. Disruptions in this area can lead to a wide range of movement problems.
And when we talk about Parkinson's specifically, it's like a gradual decline in motor skills, starting with slowed movement, then the tremors, and finally, stiffness and stooped posture.
Imagine struggling to tie your shoelaces or write legibly due to increasingly smaller handwriting, a symptom known as micrographia. These are the everyday challenges faced by individuals with Parkinson's.
It's crucial to distinguish Parkinson's from other conditions like dementia with Lewy bodies, especially if cognitive decline is present early on.
Absolutely. That distinction is crucial for accurate diagnosis and management.
So how do we approach managing Parkinson's? Is it all about medication?
Medication plays a key role, but it's not the whole picture. We need a multidisciplinary approach, encompassing not just medication, but also physiotherapy, occupational therapy, and even speech therapy.
A holistic approach to address the multifaceted challenges of Parkinson's.
Exactly.
Now, shifting our focus to a neurological emergency status epilepticus. This is essentially a prolonged seizure, right?
Yes, lasting more than 5 minutes, and it demands immediate attention.
Because it can cause irreversible brain damage.
Precisely. Picture someone experiencing repeated convulsions and loss of consciousness. It underscores the brain's vulnerability during such an event.
The notes emphasize the urgency of identifying and treating the underlying cause, like changes in anti-epileptic drug levels or infections like meningitis.
Sometimes a simple adjustment in medication or treating an infection is enough, but other times the cause is more complex, requiring thorough investigation.
And the potential complications are quite serious: cyanosis, pyrexia, even organ failure, highlighting the need for swift action.
Prompt medical intervention is crucial to break the seizure cycle and prevent those life-threatening consequences.
Let's move on to a condition that causes intense facial pain, trigeminal neuralgia.
A pain often described as one of the most excruciating a person can experience.
It stems from problems with the trigeminal nerve, right?
Yes, the trigeminal nerve, responsible for facial sensation. Imagine simple actions like a light touch or a cold breeze triggering agonizing pain.
It's amazing how everyday sensations can become unbearable.
It can significantly impact a person's quality of life.
What can be done to manage this kind of pain?
Carbamazepine is often the first line of defense. It works by stabilizing nerve cell membranes, reducing those abnormal pain signals.
So it's calming down the overactive nerve.
Yes, essentially.
Now let's talk about stroke. It's fascinating how the specific symptoms depend on the affected area of the brain.
It highlights the brain's intricate organization and specialized functions.
The notes highlight two main types: ischemic, caused by a blocked blood vessel, and hemorrhagic, caused by a ruptured blood vessel.
Both disrupt blood flow to the brain, and the consequences can be severe.
Symptoms like weakness on one side of the body, difficulty speaking, or vision loss. It's like the brain sending out an SOS signal.
Those symptoms reflect the specialized functions of different brain regions.
And time is of the essence, especially for ischemic strokes.
Absolutely. Every minute counts. Rapid treatment with thrombolysis or thrombectomy is crucial to restore blood flow and minimize damage.
It's a race against time to save brain cells. Now, let's turn to a condition that affects motor neurons, amyotrophic lateral sclerosis, or ALS.
A progressive and devastating disease that gradually leads to muscle weakness and paralysis.
It affects both voluntary movements, like walking and talking, and eventually even breathing.
Imagine the frustration of gradually losing the ability to perform everyday tasks. It's a heartbreaking reality for those living with ALS.
And there's no cure, right?
Not yet, unfortunately. But a multidisciplinary team can provide supportive care to manage symptoms and improve quality of life.
Okay, moving on to another type of meningitis, tuberculous meningitis.
This one is caused by Mycobacterium tuberculosis, the same bacteria responsible for tuberculosis in the lungs.
And it often develops after a primary TB infection.
Yes, particularly in children or immunocompromised individuals.
Unlike other bacterial meningitis, this one has a slow and insidious onset.
Exactly, making early detection crucial.
A lumbar puncture is used to analyze the cerebrospinal fluid, right?
Yes, it often reveals a cobweb-like appearance, increased lymphocytes and protein, and decreased glucose.
Fascinating how those findings can point towards a specific type of infection. Now let's talk about subarachnoid hemorrhage, bleeding into the space surrounding the brain.
A condition often caused by a ruptured aneurysm or arteriovenous malformation.
That sounds incredibly serious.
It is. The onset is usually sudden, marked by a severe headache, often described as a thunderclap headache, accompanied by nausea, vomiting, and even loss of consciousness.
And the potential complications are quite concerning: hydrocephalus, vasospasm, and long-term neurological deficits.
Those complications highlight the need for prompt intervention.
Okay, for our last neurological condition, let's discuss migraines.
A common condition characterized by throbbing headaches, often accompanied by nausea, vomiting, and sensitivity to light and sound.
And the triggers can be so diverse: stress, certain foods, hormonal changes, even weather fluctuations.
Each person's migraine experience is unique, and identifying their specific triggers is crucial for management.
And what about aura? Those sensory disturbances that can precede a migraine.
Aura is thought to be caused by changes in brain activity, often manifesting as visual disturbances or sensory changes.
Okay, shifting gears now to the cardiovascular system. Let's start with infective endocarditis.
A condition where bacteria infect the inner lining of the heart, particularly the valves.
It often stems from bacteria entering the bloodstream from elsewhere in the body.
Yes, and intravenous drug use and pre-existing valve abnormalities are significant risk factors.
The symptoms: persistent fever, chills, fatigue, and new or changing heart murmurs sound pretty concerning.
They are. Prompt medical attention is crucial.
Blood cultures are essential for identifying the specific bacteria and guiding antibiotic treatment.
Targeted therapy is key.
Now on to a condition we're all too familiar with: a heart attack, or acute myocardial infarction.
A serious condition where a portion of the heart muscle is dying due to a lack of blood flow.
It's usually caused by a blockage in a coronary artery, right?
Yes, often caused by a blood clot forming on top of a ruptured atherosclerotic plaque.
The classic symptoms: sudden, crushing chest pain radiating to the left arm, shortness of breath, sweating, or like the heart screaming for help.
Those symptoms warrant immediate medical attention.
Rapid reperfusion therapy is crucial. either through angioplasty or thrombolytic drugs.
The goal is to restore blood flow as quickly as possible and minimize damage to the heart muscle.
Next up, acute rheumatic fever.
An inflammatory disease triggered by an untreated strep throat infection.
It's amazing how an untreated infection can have such far-reaching consequences.
The immune system, while fighting the strep infection, can mistakenly attack the heart valves, joints, and other tissues.
The classic symptom is migratory polyarthritis, painful swollen joints that move from one to another.
And the Jones criteria are used to establish the diagnosis.
Moving on to congestive heart failure.
A chronic condition where the heart can't pump blood effectively enough to meet the body's needs.
It can stem from coronary artery disease, hypertension, or heart valve problems.
The symptoms, shortness of breath, fatigue, swelling in the legs and ankles, reflect the heart's struggle.
Lifestyle modifications and medications are crucial for managing the condition.
The goal is to support the heart and improve quality of life.
Now let's address hypertension, high blood pressure.
A silent killer that significantly increases the risk of heart attacks, strokes, and other health problems.
Regular blood pressure checks are essential for early detection and management.
Absolutely.
Lifestyle modifications like diet, exercise, weight management, and salt restriction can make a big difference.
They are the first line of defense.
And if those aren't enough, medication steps in.
Yes, to bring blood pressure under control and prevent complications.
Lastly, let's explore congenital heart disease.
Structural heart defects present at birth.
Your notes focus on tetralogy of Fallot, a complex condition with 4 key abnormalities.
Ventricular septal defect, pulmonary stenosis, overriding aorta, and right ventricular hypertrophy.
These abnormalities disrupt blood flow, often leading to cyanosis, the blue baby syndrome.
Early diagnosis and surgical repair are crucial for survival and quality of life.
Okay, let's wrap up our cardiovascular exploration with angina pectoris.
A condition characterized by chest pain or pressure, often described as squeezing or tightness.
It's a warning sign that the heart isn't getting enough blood.
Caused by inadequate blood flow to the heart muscle, usually due to narrowed coronary arteries.
The classic triggers are physical exertion, emotional stress, or exposure to cold.
And there are different types of angina, stable, unstable, and Prinz metals, each with varying severity and risks.
Well, we've covered an incredible amount of ground in this first part of our deep dive.
We've only just scratched the surface.
I'm ready to keep exploring.
Ready to delve deeper into these conditions.
Absolutely. It's amazing how something as simple as brushing your teeth can be excruciating for someone with trigeminal neuralgia.
It really shows how much neurological conditions can impact everyday life. And speaking of impact, let's go back to infective endocarditis.
Okay, so you mentioned bacteria can enter the bloodstream and travel to the heart, attacking the valves. But what kind of damage do they actually cause?
Well, the heart valves, they're crucial for controlling blood flow. When bacteria latch onto those valves, they trigger inflammation and damage the valve leaflets. Over time, they can even form clumps of bacteria and debris. We call them vegetations.
Vegetations.
Yeah, and those vegetations can interfere with valve function, leading to leaks or blockages. And even worse, they can break off and travel through the bloodstream.
Oh, so they can go to other organs.
Exactly, and cause some serious problems. Imagine a vegetation breaking off, traveling to the brain.
That sounds dangerous.
It is. It could block a blood vessel and cause a stroke. Or it could travel to the kidneys, impairing function, leading to kidney failure. It could even lodge in the lungs, causing a pulmonary embolism.
So infective endocarditis, it's not just a heart problem.
Right. It can have consequences throughout the entire body. That's why early diagnosis and treatment are so important.
You mentioned the modified Duke's criteria earlier. Can you remind me what those are?
Sure. They're a set of clinical guidelines that we use to diagnose infective endocarditis. They consider things like blood culture results, echocardiographic findings, and symptoms. They help us determine how likely endocarditis is based on a patient's clinical picture.
And you mentioned echocardiography. What is that exactly?
Echocardiography uses sound waves to create images of the heart. It's like a window into how the heart is working. In the case of infective endocarditis, it can actually show those vegetations we talked about, as well as any abnormalities with the valves.
Wow, that's pretty amazing.
It is. It's really remarkable how technology can help us see those tiny details. And, sometimes it can even be life-saving because it allows us to detect the condition early and start treatment.
And you mentioned antibiotics being a key part of treatment.
Absolutely. Antibiotics are essential for killing the bacteria that are causing the infection. We usually choose the antibiotic based on the specific bacteria that we find in the blood cultures.
So it's really targeted treatment.
Yes, it is. But sometimes antibiotics alone aren't enough.
When would that be?
Well, if the infection is really severe or the valve is badly damaged or if complications occur.
Like heart failure.
Yes, heart failure or recurrent emboli. In those situations, we might need to do surgery to repair or replace the affected valve.
Okay, that makes sense. And you also mentioned preventing bacteria from entering the bloodstream in the first place.
Right, that's really important. We can significantly reduce the risk of infective endocarditis if we can prevent bacteria from getting into the bloodstream. One way we do that is by giving prophylactic antibiotics before certain dental or surgical procedures. Especially for people who have pre-existing heart conditions, it's really important because they're more vulnerable.
Okay, let's shift gears to acute myocardial infarction, a heart attack. You described it earlier as a traffic jam in an artery supplying blood to the heart. Can you walk me through what happens during a heart attack?
Sure, picture a plaque, a buildup of cholesterol forming on the inner wall of a coronary artery. Now, if that plaque ruptures, it can trigger a blood clot.
And that blocks the artery.
Exactly. It blocks the artery, cutting off blood flow to a portion of the heart muscle.
And that's when the damage happens.
Right. Without enough oxygen, the heart muscle cells start to die. And the longer that blockage lasts, the worse the damage becomes.
So it really is a race against time.
It is. The sooner we can restore blood flow, the better the chances of minimizing damage. That's why it's so important for people to recognize the symptoms of a heart attack.
What are those symptoms?
The most common one is chest pain, often described as crushing, squeezing, tightness, or pressure.
Where is that pain?
It's usually felt in the chest, but it can radiate to the left arm, jaw, neck, or back.
Are there other symptoms?
Yes. Shortness of breath, sweating, nausea, vomiting, or a sense of impending doom.
So if someone feels any kind of chest pain, they should get medical help right away.
Yes. It's always best to err on the side of caution.
And if it is a heart attack, how do you treat it?
The goal is to open up that blocked artery as quickly as possible. Angioplasty is one way.
Angioplasty.
It's a procedure where we thread a catheter through a blood vessel to the blocked artery, and then we use a balloon to open up the blockage. Often, a stent is placed in the artery to help keep it open.
Oh, I see.
Another option is to use thrombolytic drugs. They're also known as clot-busting medications.
So those actually break up the clot.
Exactly.
You mentioned earlier that there can be complications after a heart attack, like heart failure, arrhythmias, and cardiac rupture.
Yes, those are all possible complications. Heart failure happens when the heart muscle is weakened and can't pump blood effectively. Arrhythmias are abnormal heart rhythms that could be very dangerous.
And cardiac rupture. Oof.
That's when the heart wall tears. It's rare, but it can be fatal.
Let's talk about acute rheumatic fever now. It's interesting how an untreated strep throat infection can lead to this condition.
It is. Acute rheumatic fever is a great example of how neglecting an infection can have some really serious consequences.
And it's because the immune system attacks the body's own tissues, right?
Yes, that's right. Sometimes the antibodies that our immune system produces to fight off those strep bacteria, they actually end up attacking our own tissues, the heart, the joints, even the brain.
The immune system gets confused.
You could say that. It's almost like friendly fire. And the heart is often a prime target. The inflammation can damage those heart valves.
Leading to rheumatic heart disease.
Yes, exactly. Rheumatic heart disease can cause permanent damage to the heart valves. The valves can become narrowed, making it harder for blood to flow through, or the valves might not close properly, allowing blood to leak backwards.
So it's not just the strep throat, it's the potential long-term damage.
That's why treating strep throat with antibiotics right away is so important. It can stop those bacteria and prevent that immune system response that attacks the body.
You also mentioned the Jones criteria earlier. Can you remind me what those are?
The Jones criteria are a set of guidelines that we use to diagnose acute rheumatic fever. They include things like carditis, which is inflammation of the heart, arthritis, and chorea. We also look for subcutaneous nodules and erythema marginatum. Then there are minor criteria like fever and arthralgia.
So you use those to help make the diagnosis.
Right. If certain criteria are met and there's evidence of a recent strep infection, then it helps confirm the diagnosis.
Okay. Now let's talk about congestive heart failure. The heart struggles to pump blood effectively.
Think of it this way. Your heart is a pump. And in systolic heart failure, the pump is weak. It can't squeeze hard enough to push the blood out to the body. Diastolic heart failure is different. The pump itself might be strong, but it has trouble relaxing and filling with blood.
So two different problems, but the end result is the same.
Right. The heart can't keep up with the body's demands.
And that causes the symptoms?
Yes. Shortness of breath, fatigue, swelling in the legs and ankles.
What can you do to help someone with heart failure?
Well, We try to support the heart and reduce its workload. Lifestyle changes are very important. Diet, exercise, salt restriction. Medications can also help the heart pump better, reduce fluid buildup, and control blood pressure.
What about surgery?
Sometimes surgery is necessary, especially if the heart failure is very severe or there are problems with the heart valves. We might do a valve replacement or in some cases even a heart transplant.
Okay, now let's talk about hypertension. High blood pressure. It's called the silent killer because it often doesn't have symptoms.
That's right. It can be doing damage to your heart and blood vessels without you even knowing it.
So someone can have high blood pressure and feel totally fine.
Exactly. But over time, that high pressure can damage the arteries, leading to heart attacks, strokes, heart failure, kidney disease, even vision problems.
So how do you find it if there aren't symptoms?
Regular blood pressure checks are really important. It's a simple test that can tell us a lot.
And if someone does have high blood pressure, how do you treat it?
Lifestyle changes are the first step. Things like diet, exercise, weight management, and reducing salt intake.
What if those aren't enough?
Then we can use medications to help lower the blood pressure. There are different kinds of medications, diuretics, beta blockers, ACE inhibitors.
Lots of options.
We try to find the right medication or combination of medications that works best for each person.
Okay, now let's talk about congenital heart disease.
These are heart defects that are present at birth.
Your notes focused on tetralogy of Fallot. What is that exactly?
Tetralogy of Fallot is a complex heart defect. It has four main abnormalities. A ventricular septal defect, which is a hole between the ventricles of the heart. Pulmonary stenosis, a narrowing of the pulmonary valve. Overriding aorta, where the aorta is positioned over both ventricles. And right ventricular hypertrophy, which is a thickening of the muscle in the right ventricle.
So basically the structure of the heart isn't quite right.
Right. And all of these abnormalities together disrupt blood flow. That's what can cause cyanosis, the blue baby syndrome.
And how do you treat it?
Surgery is usually needed to correct those defects. It can really improve survival and quality of life for these babies.
Okay, last but not least, let's discuss angina pectoris.
Angina is basically chest pain that happens when the heart muscle isn't getting enough oxygen-rich blood.
It's a warning sign.
Exactly, a warning sign that the heart is in trouble.
And that's usually because of narrowed coronary arteries.
Right. The most common type of angina, stable angina, is usually triggered by physical exertion or stress. The pain is predictable, and it's usually relieved with rest or medication.
And the other type?
Unstable angina is more serious. It can happen even at rest, and it doesn't always respond to medication.
So that's a red flag.
It is. And then there's Prinzmetal's angina, which is caused by a spasm in the coronary artery.
So that's a different mechanism.
Yes. But in all cases, angina is a sign that the heart needs attention.
Well, we've covered so much ground today. What's next?
Let's shift back to the nervous system and explore those neurological conditions in more detail.
Sounds good to me. Okay, let's dive back into those neurological conditions. Parkinson's disease is one that I'd like to explore further.
It's a fascinating condition that really highlights the complexity of the brain.
You mentioned it involves the degeneration of motor neurons. Can you explain what those are?
Well, think of your brain as a control center, sending instructions to different parts of your body. The motor neurons, they're like the messengers. They carry signals from the brain to the muscles, telling them how and when to move.
Okay, that makes sense. So in Parkinson's, those messengers are breaking down.
Exactly. In Parkinson's disease, the motor neurons in a specific area of the brain, called the substantia nigra, they start to degenerate.
Substantia nigra, that sounds important.
It is. The substantia nigra produces dopamine.
Dopamine, isn't that related to mood and reward?
It is, but it also plays a really crucial role in coordinating movement. When dopamine levels drop, it becomes much harder for the brain to control those movements.
So that's why people with Parkinson's have tremors and slowness of movement.
Yes, exactly. The signals from the brain aren't getting through properly. It's like the communication lines are down.
You also mentioned a resting tremor in your notes. What's that?
A resting tremor is a tremor that's most noticeable when the body part is at rest. So like when someone's hand is just resting in their lap, you might see it shaking.
As opposed to a tremor that happens during movement.
Right.
Okay, so we know that dopamine is important in Parkinson's. How do medications help?
The main goal of medication is to increase the levels of dopamine in the brain. One way to do that is to use levodopa.
Levodopa.
It's a precursor to dopamine, meaning the brain can convert it into dopamine.
So it's kind of like giving the brain the ingredients it needs to make more dopamine.
Exactly. Another option is to use dopamine agonists.
Dopamine agonists.
They're medications that basically mimic the effects of dopamine in the brain. It's like tricking the brain into thinking there's more dopamine available.
Interesting. So are those medications a cure?
Unfortunately not. They can manage the symptoms and improve quality of life, but Parkinson's is a progressive disease. The medications help for a while, but eventually they become less effective.
Okay, let's move on to status epilepticus. It's basically a prolonged seizure, right?
Right. A seizure that lasts longer than 5 minutes. It's a very serious situation.
Because it can cause brain damage.
Yes, prolonged seizure activity can damage the brain, sometimes permanently.
So it's crucial to stop it as soon as possible.
Absolutely. We usually use intravenous medications to break the seizure.
What kind of medications?
Benzodiazepines are often the first choice, or anticonvulsants.
And while that's happening, you're also trying to figure out what caused the seizure in the first place.
Exactly. Sometimes it's something simple, like a change in medication levels
Wow.
or an infection, but sometimes it's more complicated, like a stroke or a head injury.
So you have to do some detective work.
We do. It's important to identify the cause so we can prevent future seizures.
Let's talk about trigeminal neuralgia now. It causes really intense facial pain.
It's one of the most painful conditions a person can experience.
And it's caused by a problem with the trigeminal nerve.
Right. The trigeminal nerve is responsible for sensation in the face. When that nerve is irritated or compressed, it can cause those intense pain signals.
And the triggers can be so strange. Just touching your face or a breeze.
Even something as simple as brushing your teeth can be excruciating. It's a condition that can really take over a person's life.
What do you do to help someone with trigeminal neuralgia?
Medications are the first line of treatment. Carbamazepine is often the drug of choice. It helps stabilize the nerve cell membranes, reducing those pain signals.
So it's calming down the nerve.
Yes. If carbamazepine doesn't work, we have other options like gabapentin or pregabalin, and in some cases, surgery might be necessary.
Surgery.
Yes. If the nerve is being compressed, surgery can sometimes relieve that pressure.
Okay, let's shift gears now and talk about stroke. It's essentially a brain attack, right?
That's a good way to put it. A stroke is a disruption of blood flow to the brain.
And there are two main types.
Ischemic stroke, which is caused by a blockage, and hemorrhagic stroke, which is caused by bleeding.
Either way, it's bad news for the brain.
Yes, the brain cells need a constant supply of oxygen and nutrients. When that supply is cut off, those cells start to die. And that can cause a whole range of problems depending on which part of the brain is affected.
Weakness, paralysis, speech problems, vision problems.
It can affect many different functions.
And you mentioned that time is of the essence, especially for ischemic strokes.
Every minute counts. The faster we can restore blood flow, the better the outcome will be. For ischemic strokes, we often use a clot-busting drug called TPA.
TPA.
It stands for tissue plasminogen activator. It can dissolve the clot and restore blood flow. Another option is thrombectomy.
Thrombectomy.
It's a surgical procedure where we actually remove the clot.
Wow, that sounds pretty intense.
It is, but it can be life-saving.
Okay, now let's talk about ALS, amyotrophic lateral sclerosis.
It's a really devastating disease. It gradually destroys the motor neurons.
So the same motor neurons we talked about earlier.
The same ones. And as those motor neurons die, the muscles they control become weaker. Eventually, it leads to paralysis.
And it even affects breathing.
Eventually, yes. The muscles that control breathing are also affected.
What causes ALS?
We don't know for sure. It's still a mystery.
So there's no cure.
Not yet. But we're learning more all the time. And we do have treatments that can help manage the symptoms.
Sounds like what?
There are medications that can help with muscle cramps and spasms. And we can provide supportive care, like physical therapy and occupational therapy. We want to help people with ALS live as comfortably and independently as possible for as long as they can.
Let's talk about tuberculous meningitis now.
Yeah.
It's a serious complication of tuberculosis, right?
Yes. It happens when the tuberculosis bacteria spread from the lungs to the meninges,
Meninges.
the membranes that surround the brain and the spinal cord.
Okay. And how is it different from other types of meningitis?
Tuberculous meningitis is much slower to develop. The symptoms come on gradually, over weeks or even months. It can be hard to diagnose early on.
So it's a bit stealthy.
Exactly. It's like a silent threat that slowly takes hold.
How do you diagnose it?
A lumbar puncture is essential. We need to look at the cerebrospinal fluid.
And what do you see in the fluid?
Often, it has a cobweb-like appearance. And there are usually increased lymphocytes and protein with decreased glucose.
Those are clues that point towards tuberculous meningitis.
Yes.
Let's move on to subarachnoid hemorrhage. It's bleeding in the brain, right?
Yes, but it's specifically bleeding into the space surrounding the brain, the subarachnoid space.
And it's usually caused by a ruptured aneurysm or an AVM.
Exactly. Those are both structural abnormalities that can weaken blood vessels and make them prone to rupture.
And when that happens, it can cause a really sudden, severe headache.
Often described as a thunderclap headache, it's very sudden and intense.
And there are other symptoms too, right?
Yes. Nausea, vomiting, sometimes even loss of consciousness. It's a very serious condition that needs immediate medical attention.
And you mentioned some pretty scary complications.
Hydrocephalus, vasospasm, long-term neurological deficits. It can be really devastating.
Okay, our last neurological condition for today, migraines. Lots of people get migraines, right?
They are very common and often misunderstood.
People think it's just a headache, but it's much more than that.
Exactly. A migraine is a complex neurological event. We don't fully understand what causes them, but we do know that there are changes in brain activity and blood flow.
And there are so many different triggers.
Yes. Stress, certain foods, hormonal changes, lack of sleep, even the weather can trigger a migraine for some people.
And you mentioned aura earlier. What is that exactly?
An aura is a sensory disturbance that can happen before a migraine headache. It's thought to be caused by a wave of electrical activity spreading through the brain.
What kind of disturbances?
Visual disturbances are common. Flashing lights, blind spots, zigzag patterns. Some people have tingling sensations or numbness.
So it's like a warning sign that a migraine is coming.
For some people, yes, but not everyone with migraines has aura.
Okay, so how do you treat migraines?
Well, the first step is to try to identify and avoid triggers. And then there are medications that can help relieve the pain and prevent future migraines. Lifestyle changes are also important. Managing stress, getting enough sleep, regular exercise.
It sounds like a holistic approach is needed.
It is. Migraines are complex, and they often require a multifaceted approach to management.
Well, we've covered so much in this deep dive. It's amazing how much we've learned about the human body, from the complexities of the brain to the intricacies of the heart.
It's been a fascinating journey.
It really has. We've explored a wide range of neurological and cardiovascular conditions, and I hope our listeners feel inspired to keep learning.
I hope so too.
It's been a pleasure diving into these medical mysteries with you. And to our listeners, thank you for joining us. Until next time, stay curious and keep exploring.